couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
For those drugs, we do.
I'm sorry?
For those drugs, we do, Senator.
Well, for certain drugs. But in general, would you agree with the RAND Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common
I'm not saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do, or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the RAND Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right, let me ask you another question. We're on the Help Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but we are now regulating it for the first time, and you'll see that the ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on prescription drug TV ads?
Yes.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you on it.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any usable definition. We've now worked out a definition. There are other, and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
This hearing turned into a full-scale confrontation over one of the biggest issues crushing American families, prescription drug prices. And Senator Bernie Sanders was not about to let RFK Jr. skate past what he called an absurd statement. Right out of the gate, Sanders challenged Kennedy's claim that Americans now pay the lowest drug prices in the world. Sanders immediately pushed back with facts, statistics, and international comparisons that expose just how expensive healthcare remains in the United States. And this wasn't political theater. This was a direct collision between public frustration and government messaging. Sanders pointed to studies showing Americans still pay nearly 3 times more for prescription drugs than citizens in other developed countries. Then he dropped a brutal example. A cancer drug costing over $260,000 in America compared to roughly $56,000 in Japan. That moment hit hard. Because millions of Americans watching this hearing already know the reality. They know what it feels like to skip prescriptions, ration insulin, or choose between groceries and medication. Sanders tapped directly into that anger. But what made this exchange even more interesting was that RFK Jr. didn't completely resist him. In fact, several times during this hearing, Kennedy appeared to agree with Sanders in principle, especially on matching U.S. drug prices to prices overseas. That's a massive political opening if it actually turns into legislation. Then came another explosive moment. Prescription drug ads on television. Sanders highlighted that America is one of the only countries on Earth allowing nonstop pharmaceutical advertising directly to consumers. RFK Jr. responded by saying he would like to see those ads banned in theory. That is a huge statement. Think about it. The pharmaceutical industry spends billions flooding TV screens with ads while Americans continue paying some of the highest prices in the world. Sanders framed it as a system designed around profit instead of patients, and RFK Jr.'s response only added fuel to the debate. But the hearing didn't stop there. Sanders pivoted to expanding Medicare coverage for dental, vision, and hearing benefits, issues that directly affect seniors across the country. He painted a grim picture of elderly Americans unable to afford basic care, including hearing aids and dental treatment. Then the conversation shifted toward food policy and the obesity crisis. Sanders pressed Kennedy about ultra-processed foods and confusing food labels, arguing that parents deserve clear information about sugar and unhealthy ingredients. RFK Jr. responded by saying federal agencies are already working on new labeling standards and definitions for ultra-processed foods. So beneath the political sparring, this hearing revealed something bigger. Both sides acknowledging that America's healthcare and food systems are failing millions of people. The real question now is whether any of this turns into action, or whether it becomes another viral hearing moment that fades once the cameras stop rolling. Because Americans have heard promises before. But this exchange showed one thing clearly. Public outrage over healthcare costs is reaching a boiling point, and lawmakers on both sides know voters are watching closely. If you're tired of Americans paying some of the highest drug prices in the world while Big Pharma makes billions, hit that like button and subscribe for more full political breakdowns the mainstream media won't give you. And I want to hear from you in the comments. Should prescription drug TV ads be banned in America? And should Medicare cover dental, vision, and hearing for seniors? Drop your thoughts below. This debate is far from over.